Hello everyone. In today's Docplexus KOL interview, we have with us Dr. K Mangal, Professor and Dean of Research at the Indian Institute of Health Management Research, Jaipur. Dr. Mangal's medical and scientific acumen took him to various coveted positions like the State Program Coordinator for UNFPA of Maharashtra and Madhya Pradesh, Technical Advisor to the UNFPA, Scientist for the Futures Group, and many more. In his 40-year-long career, he has published numerous papers in peer-reviewed national and international journals of repute. Thank you, sir, for joining us.
Thank you.
So you have nearly 40 years of experience in medical research. What avenues of research have been explored since you became the Dean of Research at IIHMR?
IIHMR University is a unique university, Swati. It is the only, perhaps, postgraduate research university in health sector in India, and since its inception in 1984, this university has undertaken more than 500 research projects. Mainly the type of research that this university undertakes relates to health survey research, evaluation research, and implementation research. Now, I have joined as Dean with this university since last 3 years, and my emphasis was on undertaking research that addresses the requirement of the evidence by the policy planners and the program managers. And in that direction, we choose the research projects because mostly we do research for the clients. So we choose such projects where our research findings are directly relevant to the policy program and managers. So for example, in the last 3 years, we have undertaken 5 national health and family welfare surveys in Rajasthan, Chhattisgarh, Uttarakhand, Odisha, and the findings of these national surveys are directly relevant to the policy planners and the program managers to identify what are the issues in the program implementation, and they can use this information in making mid-course correction or reprogramming. In addition to this, we are trying out new ways, innovative ways of undertaking both health survey research by using newer technologies like CAPI or this tabs or even smartphones to collect information, and online this information is sent to the center server so that the analysis could be done faster and the quality of the data that is collected is also better. More and more we are getting into implementation research, meaning by that what are the challenges that are faced by various programs while implementing them. And currently we are doing a program with Johns Hopkins University, Baltimore, USA on understanding the learnings from the polio eradication program globally. And for India, our university is the lead agency. And in that we will document the learnings, the challenges faced and how those challenges were overcome, and we will use this knowledge in designing training programs, courses for public health professionals so that they can deal with other public health issues based on the learnings of this program. So these are some of the new things that I'm exploring. The last point that I would like to mention here is that more and more we are interested now in undertaking the research where we also own that data and we can work on that data and publish the scientific papers. That helps in creating knowledge.
Right, sir. So, sir, in the Indian context, what according to you are the, where does Indian healthcare stand and what can be done to improve it?
In the context of research?
Research.
Swati, India is a large country and we are independent since last 70 years. A lot has been done. You know, if I reflect back for the first time in 1983 when we had our first national health policy, in that policy there are a couple of paragraphs on research where they mention that we need to do this, we need to do this, organize research, develop systems and processes, and they also identified that what are the key areas where the health system research should focus. Then comes the next policy which came in 2002. That policy also more or less reiterated or repeated the same thing, and the last or the most recent policy of 2017, that mentions that the Department of Health Research was created in the Ministry of Health and Family Welfare in 2007, and this department through ICMR, Indian Council of Medical Research, was engaged in health sector research in the country, and primarily they work through medical colleges. We have large number of medical colleges in our country, about 400, and they have their own institutions, and their focus had been both the basic or fundamental research in health sector as well as the program related research. One of the problems that we still face in health sector, that the allocation for health sector health systems research or health research is very, very low. The policy mentions about it is less than 1%, while for some meaningful work, I think 4 to 5% of the public health sector budget needs to be spent on health sector research. Then we will be able to be comparable with other countries who are doing a lot of research in this sector. The other, I think, most important point is that currently the research is not seen as an important input for policy planning and programming. And most of the time, whatever little research is done in this country is not referred to or not used to the extent it should be while we design our programs. So I think we need to emphasize on this, that there should be an evidence-based programming and policies, and therefore, and when we are successful in doing that, then there will be a greater demand for good quality evidences on various aspects of healthcare issues, and that in turn will put pressure on the organizations and institutions, universities who are working in the area of health research in the country to do a good quality work and disseminate whatever research they are doing, and also that will warrant that need-based research is done. So the research should address the problems that are faced by the health system. That is the important thing. And the last important point that I would like to mention here is the research competencies. There are very few universities in this country which produce researchers, health researchers per se, and therefore there is an urgent need to build capacities of all those who are already working in various capacities, and also creating new core pool of researchers who can do good quality work. So these are a couple of things that we, and also it's not only the responsibility of the government, it's also the private sector. And although private sector always uses the research in whatever form to save taxes or whatever, but I think they need to spend more money on research. If we want to compare this expenditures with West, I think we stand nowhere. So there is very little emphasis or focus in private sector also on health research. That needs to change and improve.
Yes, sir. So you've worked extensively with UNFPA. Can you tell us about your role as the state coordinator for Maharashtra and Madhya Pradesh?
Yeah, I was with the United Nations Population Fund for more than a decade, and I have worked in various capacities in that organization. I have worked as a state program coordinator in Madhya Pradesh and Maharashtra primarily, but also I have officiated in Gujarat as well as in Bihar, and also served at the headquarters in Delhi at national level. You know, the main role of program persons in UNFPA are complementary to the government. Okay? We are technical advisors to the state government informally. I mean, there is no formal position. It's a As a state program coordinator in any state, they basically provide technical support to the state government in efficient and effective implementation of their programs. Usually all states prepare state plan of action each year, and that is submitted to the Government of India for funding support. And in addition to that, each state has its own funds, because health is a state subject. So there is a huge resources are available at the disposal of the state. UNFPA has state offices in 5 states, and these state offices were primarily there to give advice to the state government, to help them design efficient and effective programs. We also used to provide funds for innovations in the state, so that the problems are identified and innovative solutions are developed, which we demonstrate and then subsequently handed over to the state government for upscaling. If I take the example of Maharashtra, I was there for 6 years in Maharashtra, and the type of innovative work that we did was in the improving quality of family planning services. We did that by capacity building of the providers on standard protocols of family planning related supplies. And then we worked on gender issues with emphasis focus on the issue of girl child and sex ratio at birth. Our work with the judiciary in Maharashtra became an example for the country, and now the similar work is being upscaled to the other states as well. I would also like to mention that we undertook a program. It was an intervention research where we facilitated and developed a system through which the line department of the health, they themselves used to assess what is the quality of the health services that they are providing using a checklist, elaborate checklist. And then they used to identify what are the gaps in the services that the system is offering. Then what could be done to improve or bridge those gaps using their own resources that are available with the state. That program was very, very successful, and we were able to upscale it from initially 1 district, then 5 districts, and then ultimately all 33 districts of the state of Maharashtra. So there are some examples of the type of work that I have done, and I draw a lot of satisfaction of my work as state program coordinator with UNFPA.
So you've pursued research in communication planning and strategies, development methodologies for urban planning. Can you tell us what are the challenges that healthcare professionals face in these areas?
Okay, this is, I become nostalgic when I talk about my work with the state government of Rajasthan. I was with them, I was basically a state of Rajasthan government employee working in the medical college in the Department of Preventive and Social Medicine. But I was seconded to the medical directorate, and my primary role was, as one of the team members, to create a bureau for information communication in Rajasthan. We did it. One of our senior, or the director of this endeavor was Mr. Indu Bhushan. He was an IAS officer, and we took that challenge, reorganized the health education department of the government of Rajasthan, converted into Information Education Communication Bureau, and we did a lot of innovative work during those 3 years, and created a model for the state which shown path how to undertake communication activities in health sector. This model later on became an example which was adopted by the national government as well as by all the state governments of the state of India. And now everywhere this wing or unit is called IEC Bureau. Coming to this second part of your question, which relates to urban health. Urban health was left out, I think, since very beginning in this country on the understanding or premises that urban areas, people live in compact areas, people are capable of seeking healthcare, and it was also assumed that the government, the municipal bodies as well as the private sector will provide adequate health facilities and healthcare to the people because it's a question of demand and supply. You know, in last 7 decades, the healthcare providers have increased manifold in urban areas. There's a large number of hospitals that have come up of various sizes, and our corporate sector is also in this sector. And also the municipal bodies and governments have invested a lot of money in urban areas in terms of creating secondary and tertiary care health facilities. But you know, I think we missed somewhere, and I feel large chunk of urban poor and vulnerable sections of the society remained out of the reach of this health infrastructure that was created during this period. And now it has been realized, and there is an emphasis on urban health, and that is reflected by creating National Urban Health Mission as part of the National Health Mission by Government of India, and under which all state governments are mandated to develop their own plans, how they would like to strengthen urban healthcare systems, so that the access to excellent quality of healthcare to urban poor and vulnerable sections is assured. Now we have already adopted the universal health coverage as our main pillar that is mentioned in this policy of 2017 health policy, and therefore lot of reorganization is being done in the urban areas. But you know, the problems, you asked me about the problems of urban health, is one of the problem is that there is no organized system envisaged as we have a system in the rural areas. So it was left to the market forces and to the urban bodies, and perhaps the urban bodies, local self-government bodies did not perform their role effectively to meet out the health needs of the people, especially the poor. The other thing was that the private sector that has created a lot of institutions, most of these institutions are hospitals, and they emphasize or focus on clinical care or treatment of sick, while the objective of healthcare starts from promotive care, preventive care, and then comes the important role of the treatment of the sick people. Yeah. I think the emphasis of the development that took place in urban areas was on treatment of sick. So these were some of the issues, and I'm very optimistic and hopeful that with the creation of National Urban Mission, these problems of the urban health system will be addressed, and we will be able to meet the objective of urban universal health coverage for all in urban areas.
So can you also talk to us about primary health care in India? What are the challenges, and what exactly do you think would be a solution to those challenges?
Swati, this is a very apt question, because you know, it's 4 decades now since 1978, when in Alberta the concept of the primary health care was first mooted, and we became the signatory to that. And our health systems in India were reorganized based on that concept of primary health care. We did that very nicely in rural areas. So the rural health system is organized on the lines of the concept of primary health care. But as I just said, the urban areas were not included and as I mentioned that perhaps it was assumed that urban people will take care of their health themselves and local bodies will play an important role. So a lot of work has been done in India in primary health care in last 4 decades. But unfortunately, as a public health professional at this stage, I feel that the effort that was made, although there was a clear policy intentions expressed every time, whether it is 1983 policy or 2002 policy or 2015, 2017 national health policy, that due emphasis will be given to the primary health care system in India. But somehow, I think we could not allocate adequate resources in terms of budgets. We could not ensure that the infrastructure, processes, systems, human resource that is created keep pace with the time and changing needs of the healthcare in this country. The initially emphasis was on maternal and child health, and the whole system was created around that. We have a sub-center with an auxiliary nurse midwife, with a helper to take care of mother and child health and also minor ailments. So the system was designed on that. But in last 40 decades, a lot of water has flown in Ganges. Lot of transitions has taken place, demographic transition, epidemiological transition in India, where the type of demand on this health system are changing. Now we are currently facing double burden. At one hand, we still have issues around maternal and child health and communicable diseases, but on the same side, the population is aging, people are becoming well off, and a lot of behavioral related diseases are becoming more and more popular, like diabetes, hypertension and other diseases, and therefore the system has to deal with that. The system which was not strengthened adequately to perform the primary role that for which it was created, now has to deal with this double burden. And therefore, I think we need to rethink, relook. Rather, we need to go back to the drawing board, especially in the context of this National Health Policy of 2017, which has very clearly mentioned that India is committed to universal health coverage and access to health services for all without any discrimination, and the healthcare will be cashless at the point of delivery. We need to redesign our primary healthcare system in this country, and this will take not only the adequate changes in the infrastructure, and we have to also think of human resources with adequate skills and competencies to deal with the whole spectrum of health needs, and develop systems for payments for the providers, whether it will be free as being done currently in some states like Rajasthan, or it will be insurance based like the new scheme that is announced by our Honorable Prime Minister in this budget, the Ayushman Bharat, where they have committed for the first time. I think this is one of the largest scheme where 100 million families are insured, and their family members will get health coverage for 5 lakhs. These are a lot of development that are taking place. The new concept that this government has given is of health and well-being centers, is a notable concept. Now, the thinking and redesignating these primary healthcare units as wellness centers, I think this title itself will change the way we function or discharge our responsibility is at that center. So I think this will bring back the emphasis on preventive and promotive care, and then also take care of the disease burden that exists in this country. Definitely one of the challenges is that we are not adequately funding. Only the national level we spent about 1.14% of the GDP in health sector, which is very, very low by all standards. Even the poorer countries of our region spend more money than what we are spending. Although in this policy we have committed that India will raise this proportion to at least 2.5 in due course, and with this increased funding, I think a lot of things will change. So I'm very, very optimistic that the primary healthcare system will be reorganized, and there will be adequate emphasis on prevention and promotion and on public health programs. Last point that I would like to mention here, that unfortunately public health is not a separate discipline in this country. Although a lot of public health work is being done by non-professionals or non-qualified persons. I think this is high time that at national level and at state level we create this discipline as a separate discipline. Although our policy, 2017 policy, very clearly mentions this, but I think it has been left to the states, and lot more advocacy and will be required from the Government of India level and by also the all people who are in this sector, to emphasize that it is high time that we have professionals to undertake the responsibilities of public health and primary care. Then only we will be able to achieve the SDGs that are just around the corner. Only 12 years are left, and the same old system that was created for some different purpose may not deliver the new targets and objectives that are set for us and that we need to achieve by 2030. So this is it.
And this was a great discussion, Dr. Mangal. Thank you so much for interviewing with us.
Oh, it's a pleasure.